Do you suffer from hand pain, numbness, tingling, or weakness? Do your hand problems interfere with your work, sleep, driving, or the other activities you enjoy? If so, you may have carpal tunnel syndrome, or CTS. The carpal tunnel is a passageway on the palm side of your wrist made up of bones and ligaments. The median nerve runs through this passageway and controls sensation and movement in the thumb and first 3 fingers. When the median nerve is pinched or compressed, it can result in hand pain, numbness, tingling, or weakness, called carpal tunnel syndrome. If left untreated, occasional symptoms may become constant symptoms. The pain may spread up your arm to your shoulder, lead to a loss of muscle in your thumb, and even a permanent loss of strength or sensation in your hand. It's important that you act now before there's irreversible damage. Fortunately, there are a number of treatment options available. Wrist braces or splints may help but are often stiff and uncomfortable. Another option is to inject steroids into the hand, but such shots can be expensive and only provide temporary relief. Many people choose a surgical treatment called carpal tunnel release, or CTR. This procedure cuts the transverse carpal ligament to relieve pressure on the median nerve. It's popular because it's highly effective at providing long-term relief of symptoms. Open carpal tunnel release, or OCTR, is effective, but has some big drawbacks. It may require general anesthesia, a large incision, and stitches to close the incision. Afterwards, it may require the patient to wear a wrist brace and take weeks to recover. Patients may also be left with a visible scar. Endoscopic carpal tunnel release, or ECTR, uses a small camera to see inside the hand. The incision is smaller, but the procedure still has many of the same drawbacks as open CTR. So how can you get the same relief without these drawbacks? Introducing Coda, the least invasive carpal tunnel release procedure available. Coda is designed to provide full relief with faster recovery. Its secret is that it requires no incision. Surgical access is just 2 millimeters. That's about the size of the head of a pin. Coda takes only about 10 minutes, during which you'll stay awake with only local anesthesia. After Coda, there are normally no stitches and no wrist brace required. Many patients drive themselves home and are back to work in a matter of days. So why settle for this when you can easily have this? To learn more about Coda, schedule a free consultation today at www.codactr.com. Coda CTR, because your hands deserve great care.